what are some of the risk factors for hypertension?
All right, in terms of risk factors, of course, you would have heard that hypertension travels in a family, or it's something that runs in my family, persons would say. So we have risk factors that are non-modifiable and those that are modifiable. So genetics is one of the non-modifiable factors or risk factors for developing hypertension. But we want to look at the things that we can do to reduce risk of hypertension. So those would include the modifiable factors, which would be your diet, exercise. Okay, when we talk about diet, some persons get a little confused and we hear reducing the salt intake. So in general, it's having a balanced diet, but we also zoom in terms of your salt intake. The World Health Organization recommends that your salt intake should be less than 5 grams per day. So when we talk about the diet, it's not only the salt, yes, it's important, but we want you to have a balanced diet. So we also look at increasing the amount of fruits and vegetables that you would have in your diet. Then we look at exercise. In terms of exercise, we have a lot of persons who sit all day, and then when you get home, you sit again. So we have to look at physical inactivity, because that is something that will cause your organs, your body not to function optimal. And so we want to increase the amount of exercise that we do to reduce your risk of developing hypertension. In addition to diet, exercise, we also look at smoking habits. No smoking. We keep saying it all the time, and we have to continue saying that because smoking damages your blood vessels. And as I mentioned earlier, once your blood vessels are damaged, then you are at risk for developing hypertension. Alcohol use. Limiting alcohol use. I know some persons might want to take a beer or a glass of wine on occasion, but we remind you to limit the amount of alcohol intake. Another issue that we need to look at is rest. Lack of sleep. If your body is not getting enough rest, then it cannot function optimally, and so you may be at risk for developing hypertension or high blood pressure if you're not getting enough sleep.